was born in Camagüey, Cuba. My father was a general dentist and an oromaxillofacial surgeon. As most people know, Fidel Castro took over our country in 1959. And our family, my father, my mother, and my four brothers and sisters wanted to leave. I was 7 years old. We were told as children that we could take 2 toys out of the country. And so one of the militiamen there at the airport decided that he liked my toys. And I guess he wanted them for his kids and took them away. And that was the first realization I had what we were actually leaving the country all about. It was those lack of freedom. I was really terrified when we boarded that flight and we landed in Miami. And shortly after that, there was a U.S. military officer who handed me, it was some kind of candy. It was either a lollipop or some gum. And I thought to myself, yeah, things are gonna be okay. Very early on in my life, I realized that some of the relationships that we develop throughout life can be very significant. And one of the examples of that was the relationship that my father had with his residency director many years ago while he was in Cuba. When my father came to this country and picked up the phone and called him, he was able to help him. He was able to help him find or navigate his way to find where he could reestablish his career in dentistry again.
All right, how was that?
That was great.
Good, I'm glad to hear that.
In 2015, I started feeling a little bit ill, and my wife wanted me to go to the hospital, and so we did, and had a battery of tests, and the doctor came in and he said, "You have kidney cancer." And I thought of my family, my wife, my kids, my patients, what's going to happen. Eventually, I traveled to Houston. I went to MD Anderson Cancer Center, where in 2015, actually on Halloween Day, I had surgery. They removed a kidney, and they told me, things are going to be okay. Well, things weren't okay, because after that surgery, I developed a very large hematoma, which eventually didn't allow me to breathe. So on December 31st, I had to have an emergency procedure to drain that. I spent many months without being able to practice. But my colleagues, those that I have met along my journey through the Dental Association, found out what was going on with me. And not only did they pray for me, but they offered to help me in my practice. They were like family to me. And without them, I don't think I would have been able to get through. I'm alive today, not only because of my Lord and Savior Jesus Christ and the prayer of so many who prayed for me and prayed for my healing, but because of my colleagues in dentistry that helped me move forward. They came to my aid when I needed them, and that's something that I will always be grateful to.
I got an elevator.
What unites us is that we're all dentists, and no matter where you come from, the common denominator is we're all dentists, and we all have basic needs. And so the American Dental Association is here to fulfill the needs of our member dentists. Never in my wildest dreams would I have thought that I would have been elected. And now that I have been, it's just one of the greatest thrills of my life, because I actually get to lead over 162,000 of our members. And I want that to increase, because I want everyone to realize the importance of being a member of our organization, the importance of feeling that love, that support that my colleagues gave me during my difficult times. Well, now I want to pay it forward, and I want to help all of you succeed in your journeys. And I think that by working together and by creating that spirit of cooperation, that spirit of love, that spirit of collegiality, that we can all move forward together and make this profession, what I always say, the greatest profession in the universe.